Take your best shot against COVID-19. Get the vaccine. Take your best shot against COVID-19. Oh, I'm second? Oh, I'm just warming up. I have nothing.
Hey students, this is Governor Albert Bryan Jr. One of my favorite things to do is read. A good story can fuel the imagination and introduce you to places and characters you've never seen or heard of before. This summer, I'm reading 5 books, and I'm challenging students in grades K through 6 to do the exact same thing. Take my summer reading challenge and read 5 books. Choose from the books you have at home or log on to read5.org for a super selection of books you can download for free. Keep track of all the books you've read and submit the tracking sheet online at read5.org or when you return to school. My summer reading challenge ends on September 3rd, 2021. Read 5 or more, you meet the challenge, and you get invited to my big celebration. Stay safe, be good, and read 5.
Vaccinate yourself, now we go. If you from the VI and you want to get vaccinated, put your hands up high. The life you save might be your own. If you from the VI and you don't get vaccinated, put your hands up high. Be vaccinated and proud. So get the vaccine now, so we can gather with our friends and family together, so we can start back school and full the classroom, so all the kids them can learn better. Get the vaccine now. There's only one way for us to create a herd immunity in United States Virgin Islands. Get your vaccine. Starting July 9th, the United States Virgin Islands government is giving away $100,000 every week for 10 weeks. Only Virgin Islands residents who are fully vaccinated against COVID-19 are eligible. If you've only got part of the vaccine, you can also win $50,000. Take your best shot. Let's put the community first and win big. Vaccinate yourself, here we go.
Afternoon, Virgin Islanders, at home and abroad, and welcome to the Government House Weekly Press Briefing and COVID-19 update for the week of July 26, 2021. Joining me this afternoon is Health Commissioner Justa Encarnacion to provide the latest on our COVID-19 and vaccine statistics, and she will also be providing information on where you can get a free COVID-19 test and, most importantly, a vaccine this week. Also joining us today to announce the winners of the July 16th Vax to Win drawing is Dwayne Benjamin from the Virgin Islands Lottery Office and Director of Personnel Dana Clendenin to highlight the information available on the Division of Personnel's website. But before I go to Commissioner Encarnacion today, I want to make yet another urgent plea to our community. As of this morning, we have 21 individuals in our territory's hospital. This is way more than we've ever had in the territory before. Previously, we had only known about 8 or 9 total. But today, we have a serious situation. One of them is a 9-year-old child, and 5 others require a ventilator to breathe. People, this is not a game. This Delta variant ain't playing. It's very serious. It is more contagious and more deadly, and the most vulnerable in our community are the unvaccinated. I want you to really reflect on what I'm about to say. None of the individuals currently fighting for their lives, none of the individuals currently fighting for their lives against this virus, or 35 people who have unfortunately lost their lives were vaccinated. None of these people who are fighting for their lives are vaccinated nor did any of the 35 people who unfortunately passed away were vaccinated. Virgin Islanders, we are approaching the point of reimposing restrictions as we currently have 208 cases. The majority of these cases are in the St. Thomas and St. John district, but St. Croix ain't too far behind. There is no question that we are experiencing another surge, and as such, we have requested temporary support and additional resources from PAFFORD to come in and help our hospital and supplement the limited manpower we have while we go through this surge. We need everyone to heed the request to be extremely cautious over the next couple of weeks and to really hold it down. I don't think we need to experience what the BVI has experienced for us to learn. Like I've said many times before, when your neighbor's house on fire, throw water on yours. If we can get the numbers trending in the right direction again, we will. If we can get the numbers trending in the right direction again, we will be all right. Remember, this is a totally unnecessary surge. If we had 80 to 90% vaccination rate, it just wouldn't be happening because it didn't matter. It doesn't matter who comes. Not the cruise ship, not the planes, not your cousin from Atlanta or your auntie from Maryland. It would not matter because we would have enough herd immunity that we could deal with anybody who go to the hospital. Remember, it's not about keeping COVID out of the territory. It's keeping people from dying from COVID. And while it would be convenient for me to point the finger at all those other things as the culprits, it is us. It is those of us who don't want to wear a mask, who insist on hosting and attending these parties, and those of us who have not yet gone to get the vaccine. We need to do the right thing to protect ourselves and the community. Out of an abundance of caution, due to the current surge we are experiencing, the Department of Sports, Parks, and Recreation has suspended all facility rentals until further notice. The department has also suspended all sports and recreation activities for the next 2 weeks. Persons that have reserved facilities within the next 30 days are asked to call the main office to reschedule at 773-0160 in St. Croix or 774-0255 on St. Thomas. So that's my opening, but to give you further updates on what's going on now in the territory with COVID, this surge that we're experiencing, I transition you now to Commissioner Encarnacion.
Thank you, Governor Bryan. Before I begin, I'd like to thank Commissioner White for being a really true ambassador for decreasing our numbers COVID territory-wide. As of July 24th, 2021, the Department of Health has conducted a total of 141,518 tests, of which 4,375 individuals have tested positive, and 137,143 have tested negative. The 7-day positivity rate is now 4.82%, which is an increase from last week's percentage of 4.25%. Despite our pleas to get more people vaccinated and our push for mask wearing, this number continues to climb. As the governor has said, there are currently 208 active cases in the territory, 141 on St. Thomas, 61 on St. Croix, and 6 in St. John. 4,132 cases have recovered, and unfortunately, there have been 35 fatalities. People are recovering, but we are still seeing an increase in new positive cases and an increase in hospitalizations among unvaccinated individuals. Thus, our active cases continue to remain high. Of the 21 hospitalized patients the governor spoke of, 5 of them are ventilated. Many of them are in the ICU. Monoclonal antibodies, or MAB, we have given 247 total monoclonal antibodies infusion at the Snyder Regional Medical Center. This includes miraketin on St. John. So far, 107, which is close to half of that, have been administered in July. 50 total monoclonal antibody infusions have been administered at the Wang Louis Hospital on St. Croix, with 22 so far in July. again close to half. With the increase in active cases comes the increase in the administration of monoclonal antibodies in order for us to save lives. If we did not have access to the antivirals and monoclonal antibodies, we would witness a significant increase in our hospitalization and possibly deaths. That being said, hospitalization and severe illness will continue if we are too slow or hesitant to get the COVID-19 vaccine. The benefits to getting vaccinated far outweigh any potential side effects. The benefits of getting the vaccine outweighs the possibility of you fetting, not being vaccinated, and getting sick, in other words. Some people have reported a sore arm, fever, chills, fatigue, or muscle pain, among other mild symptoms. The long-lasting effects of actually getting COVID-19 can be very damaging and are more worrying than the temporary effects of the vaccine, which are normal. Since we reported the presence of the Delta variant of COVID-19 in the territory, the community has been on high alert, and we have seen a significant increase in first doses given at our community vaccine centers, both St. Croix and St. Thomas. Thank you, Virgin Islanders. We cannot afford to lose anyone else to COVID-19 when there is a vaccine available. Let it not take the death or severe illness of a family or friend to encourage you to get vaccinated. Remember, if it's okay to have questions, it's okay to have some concerns, but the best thing to do is to go to the Department of Health or CDC or World Health Organization website and get the answers that you need the right way. Not anyone can give you the question. There are individuals out there who are afraid themselves of the COVID vaccine and thus are skeptical and are encouraging others not to receive the vaccine, knowing that that too would hinder our community immunity, as the governor spoke of, and lead to more hospitalizations and death. We are still making an effort to get more Virgin Islands vaccinated. Our positivity rate and high rate of our hospitalizations are a reflection of high number of unvaccinated people in the territory. We've seen the virus mutate into more transmittable and deadlier variants and need to all take action now to mitigate the risk of more mutations occurring. Yes, the Delta is only one of many variants that the vaccine, the COVID-19 virus has actually stimulated, and others can come. We all have the necessary tools to do this. Masks are available in many stores in many colors, and they are even reusable, washable masks. Masks are required in all establishments, so everyone has a responsibility to wear one, even if you have been vaccinated. The COVID-19 vaccine is very accessible. Anyone who is unvaccinated is more of a risk of getting COVID-19 and undermining our chance of achieving community immunity. So far, 43,856 people have had at least one dose of the vaccine, which means that about 49.06% of the eligible population that can be vaccinated has had at least one dose. 37,005 individuals are fully vaccinated, or about 41.40% of our eligible population count of 89,395. You may see that the numbers vary somewhat. There are two different databases that we're looking at. One that the federal government, both actually the federal government has implemented, and what you hear, one is called VAMS, and the other one is one that most of the nation is using at this point in time, and there is about maybe a 3 to 5% difference in our numbers, but we will continue to utilize our Tibera system, and that will give you more consistent information. Just to let you know that that information is about 3 days delay. So if you see numbers and hear numbers within a territory and you see national numbers, that is because of that 2 to 3 day delay. Anyone 12 and older can get the COVID-19 vaccine by walking into any of our community vaccination centers by calling 340-777-8227 or by scheduling yourself online at covid19usvi.com/vaccines. You can call, but you can also walk in. If you are the parent or guardian of a child aged 12 and up, Please make sure to accompany the child to his or her vaccination visit and bring an ID for both of you. For example, the child's birth certificate will definitely suffice. The department's epidemiology hotline remains open 7 days a week from 8 a.m. to 12 p.m. For callers to report suspected cases of COVID-19, please call 340-712-6299 or 340-716-1519. We are also offering free vaccines at our pop-up testing sites weekly. Anyone can pre-register for pop-up testing online at covid19usvi.com/testing. The following are our upcoming events. So this is for pop-up testing and pop-up vaccinations. I prefer you go to the pop-up vaccination site, but if you need to get tested, you know where to go. On St. Croix at the Charles Howard Complex, Tuesday, July 27th, which is tomorrow, from 10 a.m. to 12 p.m., and Thursday, July 29th, from 10 a.m. to 12 p.m., again at the Charles Howard Complex. In St. Thomas at the Home Depot, and that's tomorrow, the 27th, from 1 p.m. to 3 p.m. St. Thomas at the Lionel Roberts Stadium, Thursday, July 29th, from 1 p.m. to 3 p.m. St. John at the VI Port Authority Gravel Yard, Wednesday, July 28th, from 1 p.m. to 4 p.m. The United States Virgin Islands Department of Health has launched a digital COVID-19 vaccine record. Yes, you've been waiting for this for some time. It will be used to assist in the travel portal starting Wednesday, July 28, 2021. Virgin Islands who have been vaccinated within a territory against COVID-19 can now apply for a digital vaccine record. To request your digital vaccine record or to join the network, the process is simple. It is based on securely verifying your identity and vaccine history. Individuals should visit covid19usvi.com/digital pass. I'll repeat that, covid19usvi.com/digital pass to start the process. If you have any difficulty getting your digital pass or need assistance, please call the EPI hotline, 340-712-6299 or 340-776-1519. We continue to collaborate as we pray for the BVI residents on a daily basis. In addition to the verbal collaboration, we have actually sent to the Department of Health epidemiology staff, Raquel Conhoff and Jordan Lake, to the BVI to assist them with their outbreak. They've been there a little less than a week. They brought 120 tests with them and so far have trained about 20 BVI staff in how to run the Binax antigen testing. They have also set up electronic reporting using the same beacon system we utilize within the USVI. Rapid testing is now being conducted for the seaport and airport in the BVI. It's very exciting to hear the good news of additional vaccine lottery winners. Congrats on being vaccinated and also on your big win, but the governor will speak about that in a few minutes. To keep up with the latest information, please visit the U.S. Virgin Islands Department of Health Facebook page or our website, www.covid19usvi.com, or for COVID-19 information alerts, text COVID-19 USVI to 888-777. Thank you for listening to me, and Governor, thank you so much. Everyone have a blessed and safe day.
Thank you, Commissioner. And I want to thank people like Sugars Joseph, who's on Facebook right now on our live. You always know when something's going on because you see more people watching our live. You go from like 400 to 1.1 thousand like we're seeing today. Sugars Joseph is telling people, she's tired. She's a healthcare worker. She's tired, very tired. And I saw Barbara Donastarg on there. I'm getting a lot of concerns from grandmothers and grandfathers. They're saying that we shouldn't send kids back to school. People like Myrna Van Beaver, who has a good editorial today in the paper asking about returning to school. I always tell people I like the children of Atlanta, but I love the children of the Virgin Islands, and we're not going to put them in any unnecessary risk or harm. So we are looking at the start of school again and what we can do there. As you know, right now with the way that we're trending, it looks like we're going to have to push it back a little bit, but hopefully not. We're doing everything we can to make sure schools open on time. As I toured them last week, trying to make sure that we keep the pressure on. But we're not going to put our kids in any danger, you know. And certainly, the children are resilient. We're not going to put parents in any danger. But get vaccinated. This is what we could do to make sure that we stay safe. And, you know, is a Delta variant. I don't know, those of you who are Greek, you're going to get epsilon, zeta, eta, theta, iota, kappa, lambda, mu, nu, z, phi, and omicron. Because this thing is going to keep doing variants, and we have to be prepared for that. So at some point, you're going to either get that monoclonal antibodies or you're going to get the vaccine. Save the wait. Don't take the chance. Get vaccinated now. Now for some more encouraging news. Last week we made the payout as authorized by the Senate for retirees over the age of 65. We are currently preparing to make another payment of 8%, but we're still waiting on the legislature to pass a legislation authorizing us to do so. So, you know, I like to educate the public all the time. We can pay the teachers and the steel workers now because they had a case and it's a judgment that was ruled against us. But we can't pay everybody unless we get the approval from the legislature. That's why we sent down the legislation 3 months ago, trying to get some authorization to do it using our dedicated funding source, the excise tax, but we could pay it before the end of the year if things continue to trend up. And they may not, because now we have the HES and we also, the Lime Tree closure, and we also have the CDC predicting that we're probably gonna see another U.S. shutdown in September, August or October, based on the trending that they're seeing now with the virus. But in the meantime, I want to make sure that we keep with our promise to the people and being transparent in our approach to everything we do. I want to introduce our Director of Personnel, who is going to talk about more cash for you. Director Clendenin.
Good afternoon, Governor Bryan, Commissioner Encarnacion, and of course, the viewing and listening audience. As stated, my name is Dana Clendenin. I'm the Director, Division of Personnel. It's truly wonderful to have the opportunity to give you some updates and all the wonderful things we have going on at the Division of Personnel. Today, I just want to talk briefly about the release of the $10 million to the retirees over the age of 65 who served in a collective bargaining agreement. It's important for me to say that, as well as to talk about the transparency website with the 8% payment, and then share with you a little bit about our recruitment efforts and open enrollment. So to begin, on July 22nd, Department of Finance mailed out the checks to retirees age 65 and older who were part of a collective bargaining agreement who were owed retroactive wages from 1990 to 2001. That check was in the amount of $1,700 minus all applicable taxes. It's important to note this is not an annuity payment, but rather retroactive wages. Therefore, all applicable taxes must come out. Retirees, you can still, if you haven't received for some whatever reason, haven't received your check, please go to our website, dopusvi.org/retirees. Enter your last name, the last 4 digits of your social. If you do not see the information there, we also have a form that we'd like for you to complete and upload necessary documentations because we want to ensure you get your piece of the pie, as well as those for survivors. Maybe you have a retiree that passed away that's entitled to the benefit. We also have very detailed instructions for you at that website as well, dopusvi.org/retirees. We also have a dedicated hotline for you. You are so important to us, 340-714-5010. We are happy to serve and answer your questions, so please call us on that. As for the 8%, in anticipation of this payment and our commitment, as Governor Bryan mentioned earlier, to transparency, we've also created a portal for you. That portal is live and up and running and ready for you to check to see what your payment may be. It is dopusvi.org/8%. You can also go to our website, dopusvi.org, click on employees, and the information will populate right there. We're asking for your last name and the last 4 digits of your social, and you will see there for a 2-year period what your estimated payout is, and this is all pursuant to Act 7261 as well. If your name for any strange reason isn't listed, you will also find detailed information as to the form you are to complete and upload so that we may begin the investigation for you. Because like we said, and the governor has said always, you owe the people, pay the people. So we want to make sure you get your 8%. The same would be said for survivors. You know somebody who's entitled. We also have documented information there. We need you to follow and upload. If I can transition for a minute to hiring and recruitment, you know, we are so excited about this. As we've stated before, we are open, we are hiring, and if you know somebody that needs a job, wants to start their career right here, the government of the Virgin Islands, believe it or not, is the place to work. So if you will go, please visit our website and apply for the more than 88 jobs we have listed there. We also have the opportunity, sometimes we don't see the job we're looking for. We have a section right there on our website where you put in your name and some necessary information, upload your resume, and we will take it from there, simplifying the process for you. I just want to quickly talk about what we did in Atlanta on July 10th. This was a well-attended event, upwards of 300 attendees. We've seen 15,000 hits, comments, likes, shares, posts. I'm so glad my commissioners, thank you to all of them that participated in the forum, because they had the opportunity to do impromptu interviews, which was really, really awesome. And that was in the area of nursing, law enforcement, the justice system, finance, communications, and education. So we are really excited about that. Again, dopusvi.org. It is right there for you. I also want to tell you about a pilot program, the GVI Financial Fellows Program. If you have a young person just graduated from high school, not really sure what they want to do, they think they're interested in serving in government, this is the program for them. Go ahead and go to our website if you have a background in finance or even computer science, accounting. We want you. And this program allows you to serve in the government for a 2-year period. You gain some experience, you gain some knowledge as to what we are all about, and of course, we hope to retain you. That's the GVI Financial Fellows Program. I urge you to go on our website and look at that. And lastly, open enrollment for all my actives is August 16th through September 17th. We are going to send you some more information. This is your opportunity to make the necessary changes on your medical and dental plan. Anything you see fit, please update your beneficiaries. I can't tell you how important that is. If you will, please like us, follow us, DOP on our Facebook, Instagram, LinkedIn, and Twitter. Thank you so much, Governor, for the opportunity to speak to the people today.
Thank you much, Director Clendenin. And I just want to stop for a second to do 2 things. The first one is our Financial Fellows Program. This is one of the things that we have been trying to get going since when I was in the Young administration. It's a pilot program that we're doing now. So what we're hoping to attract is college seniors or graduates, people who are in grad school, or people who are working on their PhD that want and are young in their career that want some experience in government. We're hoping to get these people in, get them engaged in a job, pay them a nice salary, and then transition them out to other departments. We're starting in financial, but there's a lot of room there. And then financial, when you look at the flyer, there's project managers and the like in there too. So if you have an interest in participating in the program, go ahead and apply. Please tell your sons, daughters, cousins, whoever, that this is available. We're really trying to do things that are broad so we can get young people into the government. I have a young lady who wrote me, who is a history major, and we're trying to get her in the program. We're trying to get new talent, and we do it. The Director Clendenin has done an awesome job at the Department of Personnel, and her last job is to recruit her replacement, which she failed to mention. But she is, as we always want to make sure that we spread our talent as much as possible and keep pushing people to do more. We are sending her over to the VI Housing Finance Authority, where we know she will do well. Mr. Griffith needs a lot of help with that Envision program, the landlord program, the rental program, the mortgage program. So we're looking to see big things out of her as we power through and get a lot of these CDBG and all these other things that he has on the road. So she'll be joining him over there as the Assistant Director of the Housing Finance Authority, and we congratulate her, but she can't go until one of y'all apply and get her job. So send your resumes to her or myself if you're interested in leading the government's human resources effort. And then once again, I'd just like to thank you, Dana, for an awesome job on the cabinet.
Thank you.
We're sad to see her go, but she only moved in next door, not in the next state. In other news, more good news, as I mentioned with you earlier, mentioned to you, we have Mr. Dwayne Benjamin, who is the Deputy Executive Director of the Virgin Islands Lottery, to announce the winner of the July 16th Vax to Win drawing. Remember, we're 1 week behind and everything. So, Mr. Benjamin, the floor is yours.
Thank you, Governor. Good afternoon, ladies and gentlemen. Good afternoon, Communication Encarnacion and Director Clendenin. It gives me such a pleasure to see the resounding participation of this program. And the winners of the July 16th drawing, I am happy to report from the island of St. Croix, that winner is Aretha McFarlane. Ms. McFarlane is our winner, and she knows the procedures that she will have to now go through to come and receive and retrieve her check from the Virgin Islands Lottery. Also, St. Thomas winner is the youngest winner thus far, and that individual is Zaibing Yu. And his participation in the program is a testament that young people also are encouraged to participate in the vaccine and get the vaccine and participate in this program. So it gives us great pleasure today, Governor, to announce these winners. They know the protocols that they have to go through, and as soon as the processing is completed, it'll be my pleasure to hand them their check of $100,000 to each. Thank you.
Well, that's fantastic. Thank you, Mr. Benjamin, for that. And congratulations to Ms. Aretha McFarlane and Mr. Zinbing Yu, who is accepting the prize on behalf of his daughter, Rena, who is a Virgin Islander attending college in Florida. Thank you for taking your best shot and for protecting yourselves and our community. The names of the next two winners have already been drawn, and we are in the process of confirming their residency and other eligibility requirements. Their names will be announced at next Monday's press briefing. For those of you out there who are not yet vaccinated, there is still time to go out and get vaccinated. I'm going to say that like 100 times during this show, so you can get sick of it. Don't forget the special drawings for the school-based personnel, which is open to teachers, faculty, staff, and everybody at our territories, public and private and parochial schools, as well as our school bus drivers. Everybody is invited, anybody who's participating on a school-based level. There will be 3 winners per district, a first place winner for $25,000, a second place winner who will take home $10,000, and a third place winner who will take home $5,000. We have more than 998 school-based personnel that have already entered so far. So if you are eligible, go out and get vaccinated and register before August 9th drawing. The most important thing about that there is that we want to make sure that we're getting the teachers, personnel, bus drivers, everybody safe as we enter back into school, because if they're vaccinated, it makes your children a little bit safer. The Virgin Islands will be represented at this year's Tokyo Olympics. That's great news. We are proud to have Nicholas D'Amore competing in the men's archery, Natalia Coopers in the women's swimming 400-meter freestyle event, Adriel Sanis, the nephew of our very own at St. Croix Administrator Samuel Sanis in the men's 100-meter and the 200-meter breaststroke event, and veteran Olympian Eddie Levette in the 110-meter hurdles. We congratulate all our athletes for accomplishing this feat in their career. And even though we are not there physically in the stands, know that the entire Virgin Islands community and family will be cheering you on. Congratulations. Be safe and bring home the gold. There is an old quote by one of the most famous presidents of modern history, John F. Kennedy. He said it in his inaugural address. Ask not what the country can do for you, but what you can do for your country. It has been used over the years in so many ways, but never more relevant than it is today. See, last year we were in a terrible state when this pandemic started to impact the United States. The first hit was definitely to the health of our citizens, and secondly, to the economy of this great nation. Not a single spot or person was spared, and everyone was impacted from the health mandates and the shutdowns. We asked, what is our country going to do for us? And in the VI, it was no different, as we figured that we would have to fend for ourselves until the national leadership had finally figured it out. We went to work and secured funding for immediate needs like protective equipment, masks and ventilators, expansion funds for hospitals, and extra medical staff to make sure we had people to take care of you, economic support in the form of stimulus checks, and pandemic food stamps. We paid everyone's light bill and provided scholarships for students going to school. We secured funds to supplement rental payments, utility payments, and even mortgage payments. We set up the portals so people could get in safely and out safely. We expanded our tourism reach and expanded our marine economy. We lobbied to get the vaccines first and open them up to the public, the first in the nation to do so. You asked, and the country responded. And we responded to this and many more initiatives. All we're asking you to do now is one thing: get vaccinated. Thank you, and I'll take some questions from the press now. We don't have any questions? Let's see, I think.
Hello, good afternoon. Can you hear me, Governor?
I can hear you fine.
Awesome. How are we doing today?
Good.
Sir, I have a concern. I'm just wondering, how are the hospitals coping in your estimation? You said that you recently had to hire or reach out to your procurer of services to get more nurses in there. Could you describe that effort and, in your opinion, how the hospitals are coping with this latest surge?
Well, I mean, we had a full year to prepare, or year and a half to prepare. They're faring well, but it's like, I like cycling because that's what I like to do, right? You want to ride up the hill at the beginning of the ride, not the end of the ride when you're exhausted. And Sugars has said on Facebook, our healthcare workers are tired, our police are tired of dealing with this. So we have the capacity in terms of the ventilators and the equipment, but people are people. And they're having a rough time of providing this support, not only to us, but to the BVI as well, too. I don't know if Commissioner Encarnacion have anything else to add on that. She serves on the hospital board, but it's not easy at all.
Actually, because they're the ones who's actually also administering the monoclonal antibodies. So, of course, the pharmacists are now involved in that as well. So it's not just nurses per se, but all the clinical, non-clinical and clinical staff at the hospitals, both RLS and JFL, who actually have an increased level of their scope at this point in time. So they're doing okay. We're making sure that we balance that with the number of staff that's needed. However, it's not easy at all. Actually, today we're actually providing some more education for them from the Department of Health as well. So that'll continue.
I'll tell you what, though, I mean, that's the key thing here, right? So even though the 208 number scares me, what scares me more is 20 people in the hospital. If that number doesn't go down, we are already making contingency plan and what we'll have to do if we have to do another shutdown, because that's just unacceptable. The hospitalization rate is just, if you look at our numbers, the Delta has just doubled everything. I know in the BVI they're saying that they don't have the Delta yet, but if they don't have the Delta yet, they're in big trouble, because that's going to ravage them even more. I mean, because we're not doing anything really differently. True, I've seen people on our comments mention that people aren't wearing their mask as much. This is true, but people aren't coughing on people, or they for the most part, if they're not wearing a mask, they're social distancing a lot. So how is this variant getting transmitted? I mean, this is really transmissible and highly contagious. So if we have to deal with this for the next couple of months, you could expect us to have some kind of imminent shutdown. And like I say, this is an unvaccinated problem, not a vaccinated problem, because we've had people get vaccinations and get sick, but they sniffles or whatever, and then they're good. So.
And then,
Lesiba, 1 second, sweetie. Two things to add to the governor. One, it's not just the hospitalizations, but it's the people that are on the ventilators.
That's right.
That's really critical. And two, the governor spoke about how infectious or how contagious the Delta variant is. Someone mentioned, actually an epidemiologist mentioned just last week, that you can actually double or triple the number of viral particles in your nostril. That's where it actually is kept from the Delta versus the other variants. So that actually shows exactly how contagious it is and why it's as contagious as it is. And that's why it's important to actually keep your mask. But not just wear your mask, but wear your mask right.
Yeah.
Thank
Over your
you.
nose, on your face.
Thank you so much.
One more thing, Lasiba, too. I think people, that the untold story of the COVID victims post-COVID. Yeah, you live, but there's an unprecedented amount of people now listing for lung transplant. People are living with scarring on their liver, on their kidneys, in their lungs. So it's not only about surviving COVID. There are people who are going to be, for years, going to be impacted by the health impacts of this virus on their body.
awesome. And that's truly sobering. And sir, I was just wondering if I could get your red line numbers. Like, where would we have to go in terms of hospitalizations, active cases where we would see school delayed, and then also a shutdown?
Yeah, if our active cases move to 250, definitely we're going to push school. And I think our hospital numbers right now are like maxing out at 20. We always, our COVID call now is Tuesdays and Fridays. I always wait till Tuesday because today you'll have some recoveries and you'll have the tests from today, and I'll kind of give you a projection of what the week is going to look like. But, you know, I hate to make the divide, but it's happening in the country between the vaccinated and the unvaccinated. And we're going to have to make some decisions where people who are unvaccinated, you're going to have to produce a COVID test in order to get into work, in order to participate in certain activities. I don't want to do that. You know, we have one community and I'd like it to proceed as one, but we're not going to shut down the entire economy because, you know, 30 or 40% of the people don't want to take a vaccine. We're going to have to figure out a way to keep the 50 or 60% of the people who need to make a living and do everything else viable. So that's something to think about as we move forward, because it's one thing to shut down when there's an end in sight, but there's no end in sight. We're going to be dealing with COVID for another year or two, minimum. I hope that answers your question.
It does. Thank you very much, sir.
No more questions?
Can you hear me?
Yes, I can.
Good afternoon, Governor. This is Diana Diaz with the VI Source.
Hi, Diana.
Hi, I have two questions for you.
Mm-hmm.
Okay, with the current surge of cases, at what point would you decide to put into place possibly any curfews or any closures if needed?
Yeah, I don't see curfews. You know, and anybody who's been following me, I don't believe in curfews. COVID will come out in the day and the night. I just try to get people home before they get too much alcohol in them. That's what that alcohol curfew is about. And then if we ever move towards shutdown, it's going to be a complete shutdown, and that would have to get our kids would have to go at least up to 300 or more. I hate giving numbers because it's always a factor of it's a factor of the projection, how many people in the hospital, and what kind of staffing we have, as well as the number of cases.
Okay. And with the closure of parks and recreation for the next 2 weeks, does this include the closure of summer camps as well?
That I don't think it does. It does? Okay, it does include summer camp as well.
Okay, that's it. Thank you.
You're welcome. Only person left is Ernest. I don't know if he has any questions.
Gov, can you hear me?
Yes, sir.
All right. The first question here is for the commissioner. She announced the portal will be opening, the vaccine portal on Wednesday. And at the same time, I think, Commissioner, you mentioned the digital pass. And what I wanted to understand is the distinction. So do we have, one don't need to be part of the digital pass program to be able to submit, say, a vaccination verification into the portal system to be able to, say, come back home to the territory without having to take another test, right?
Correct. It's the same, actually the same program. So the digital vaccine records actually relates to both aspects. So you can actually test out, or you can actually opt out of going into the entire program. And the entire program actually is going to allow us to be able to access or to let individuals know who has been vaccinated in an event. But that's HIPAA is involved in that, so that's why you actually have to opt in or opt out of that. But it doesn't have anything to do with your portal. Once you are vaccinated within the territory and you put your information in, you would actually be given the green QR code as a result of that.
Excellent. Thanks for that clarification. I also wanted to, I know you mentioned, Commissioner, that we've seen an increase in vaccination since of course, the announcement of Delta variant, more hospitalizations. What is that exact number? What is that increase are we talking about? How significant is it?
Not as significant as we would like to see it, but we're actually right now, first doses, 150 to 200 on a daily basis, which is really great. We were actually seeing down to maybe 50 first and second doses. So if you're looking at that, we're tripling the number of vaccinations for first doses.
If we look around, Commissioner, I guess this is for Commish or the Gov as well. If we look around the territory, the nation, and we look at vaccination rates per state, we are still kind of mild, I would say. We haven't yet crossed the 50% mark. Of course, we have the announcement and we have this ongoing, the Vax to Win lottery there. And the governor yourself, you've been pressing so much the importance of vaccination. I wanted to ask this question. Obviously, there's a lot of hesitance in our community. And what would you say, and I guess both of you could answer this, but what would you say to the folks who have legit concerns, right? So let's look at the FDA for one example. So the FDA has given emergency approval to the vaccines that have been approved in America, but it is still going through the process of giving that approval that it usually gives after it has tested and performed all its testings to determine whether a drug is safe for use. So you have legit concerns there. What would you say to those folks? And because sometimes I sympathize. I'm fully vaccinated, but I sympathize with folks who have concerns. So what would you say to those people to reassure them that the vaccine is safe and you'll be okay?
So let's go with the data. That's one of the things that I would say, and science. And the science have actually proven that a vaccine is safe. 99.9% of the individuals who have had COVID have not been vaccinated. That's a given. It's a fact. And in terms of the complications that we're seeing over the nation, over the world, has been minimal compared to the number of deaths that we've also seen as related to COVID-19. So one of the things that looking from the EUA perspective, they're doing what the nation, what the world wants them to do. If they hurried up and said, okay, you know what, let's go ahead and approve this, then the question will be asked, did they approve it too soon? So they're taking the time on a month-to-month basis, and I actually got an opportunity to speak with 2 people who are undergoing the trial. They meet with them on a daily basis, weekly basis, test them on a monthly basis. So these tests are actually being done. And I think it's only after they get to the point where they are comfortable and ready to say that everything is where it's supposed to be, then they will provide a full authorization. However, the EUA has proven to be very beneficial and has saved lives. So continue to seek the correct information and figure out exactly what's legitimate and what's not legitimate.
So one of the things we're going to do, Ernest, is we're going to do an anti-vaxxer roundtable, and we're going to do it in Facebook. We're hoping to get some live audience and bring people in and invite people to come online and ask questions, people who don't believe in getting the vaccine. So we plan to have some people who've actually had COVID there to talk to people about what it is like to get COVID and their experience. So we can have a forum to answer these questions in the most medical way. But me, like, I got a practical answer for you. The number 1 killer in the Virgin Islands is hypertension, heart disease, and diabetes. And people sluxing down macaroni and cheese, stuffing, seasoned rice every single day. Sauce and all of this other stuff. They're putting on clothes, washing chemicals that are poison your body. They're spraying dyes and all kinds of things in the hair. They're going to nail shops where they're filing down and inhaling all kinds of toxins every single day and painting themselves in the hair and the fingers with all kinds of things that contaminate your body. They're putting phones to the head full of radiation and all kinds of other things that are messing with their system. And every day and night, they're going to bars and places and drinking sodas and all kinds of other alcohol and other kind of toxins in their body that they never know where come from. They're eating fast food in restaurants. They don't know how it's made, what it's made from, or what kind of plastics are in it. And you're going to tell me about vaccines? Let's get real. If the government had wanted to poison you or kill you, they could have done so a lot faster. And all they have to do is put it in an app. I mean, all of the arguments that I've listened to, you know, vaccines have a long history. In 2021, we don't need to be going through the Black Plague of the Dark Ages because people don't want to take the medicine. In so many places in the world, people wish they could have this medicine in order to survive. Bottom line, if you get sick, you're going to be begging for the monoclonal antibodies, which is the same technology that we use in the vaccine. Thank you.
Thanks, Gov. And lastly, thanks for that response.
Oh yeah, one thing, Ernest, the summer camps closed last Friday, so that's not affected by the sports closure. So summer camps are
okay. Okay, thanks for that, Gov. And lastly, I wanted to talk about what is being said or what is being deemed the new percentage to achieve herd immunity. We're hearing 80 to 90%, and that is a result, of course, of the Delta variant. As you mentioned, highly transmissible. It is said that with Delta, 10 infections would likely result in between 60 to 70 new infections.
Right.
And so I'm talking about this because, you know, we'd spoken about year-end events, talking about the Cruise and Christmas festivals, and when the territory would probably transition into what is being considered a new normal, right? Where we have arrived at a level of herd immunity. With Delta, Governor, what is your projection from now till December? What are we looking like, and where do you think we'll be?
Well, you know, that's totally up to us. If you want to fet, then we'll get vaccinated and we'll come out. And if we don't, well, we won't. You know, I can't project that. I don't know what the response is going to be. And I remember, you know, I keep saying it because I like clarity. We are just trying to make it so that if you get sick, we could take care of you. People don't get sick no matter what. But if you get sick, we could take care of you. You got a flu, you got a COVID, we got you. You go get some monoclonal antibodies, we have available respirators. Our deepest fear is that we won't have that available. If we get to 70% in the Virgin Islands and we checking everybody who coming in, we good. You know, festival is on. But if we can't get up there and get that, yeah, we ain't fetting this festival. We're gonna be watching it on TV and reruns from old carnivals like we did last year. So, you know, do your best, man. You know, for whatever reason you take the vaccine, just take it. You know, let's get going.
Gov, thank you.
Hey, thank you, Ernest, and thank you for all the work you're doing, trying to spread the word, getting people to get the vaccine, and all the media. Really appreciate that. There are a lot of things going on in our community, like the universities making a push now so that everybody has to get vaccinated. You know, it's an incredible amount of money that it costs us when we shut down. And people say, you know, why you won't shut down? You know, the last time we shut down, we had 10,000 claims to unemployment overnight. That's a nightmare, getting all those people their unemployment checks, people waiting on money to come so they could be okay. They lose their jobs. You know, we don't want that. You know, we want to push forward and be okay. But that's it for today. We don't have any more questions. Just, you know, get vaccinated, stay safe, stay sanitized, wash your hands. Love you. Have a great day.